This is Jeff Strickland from MOT 136, Introduction to Clinical Skills, and I'll be performing Procedure 30-6, Preparing Patient's Skin Before Surgery. I have my area in which I'll put the patient to clean the surgical area, and then right next to that, because I just have my desk to work with, a simulated tray with my supplies. I have a betadine scrub sponge, 2 betadine swab sticks, a razor with gel, a towel, a cleaning towel, and some gauze to blot excess solutions. Wash my hands. I've introduced myself to the patient, Rupert. I'm also verifying that Rupert is having surgery today, verifying he's the right patient, so I'm asking for his full name and date of birth. I go over the procedure that I'll be performing on him. I position him in a comfortable position, so I've taken his arm off of his body and laid it down in front of me. His body doesn't have any arms, so I wash my hands and I put the waterproof towel underneath his arm. And I've also verified that I'm scrubbing the right spot, that I have the correct surgery spot. Wouldn't be good to do the right arm when it's really the left arm. So we're doing this left arm, we're doing a mole excision. So I've donned non-sterile gloves. I'm going to clean the area. I just cleaned the mole off. I'll draw it again. Rupert's having a mole removed, so this is my simulated mole. Yeah, that's better. Okay, now we're going to shave. He doesn't really need to be shaved, but we'll do it anyway. And so that I don't really cut the rubber on Rupert's arm, I'm leaving the safety cap on this and simulating the shaving. We're going to shave against the grain. So his hand is here, his elbow's here. And we'll wipe away any excess hair that he doesn't have. And then what we're shaving is 4 inches around the precision site. Discard the razor into the sharps container. Dispose of the cleaning towel. I'm removing my gloves and disposing of them as well, and rewashing my hands. Now I'm putting on a new set of sterile gloves. So what I'm going to do now is Rupert's going to just lift his arm up. I'm going to I'm lifting Rupert's arm for him. I'm going to change the absorbent towel below him. We'll just move his elbow out of the way with a sterile. Careful where I'm touching, I'm just touching the corners. Rupert puts his arm back down, and I'm going to wipe Rupert's arm. Use the betadine sponge and scrub it, and it's not going to stick, so you won't see a painted area. Blot it with gauze. We want it to be dry when the surgery is performed. And now I'm going to paint the surgical area with betadine swabs. And I'm using more than one swab so that I'm making sure that I'm not getting contaminating the area. Now disposing of the supplies. Removing my gloves and washing my hands. And then the final thing I will do is document the skin prep in the patient's medical record.